In the summer of 2016, the leader of the administration then set up a Health Inequalities Health Commission, and it was to look at the health and well-being of this city. And I will take this opportunity, my predecessor, Bailey Ann Simpson, I genuinely want to thank her for the work, the effort and the contribution she made, and indeed all the contributors have made this got where we are today with our recommendations. Nationally, the facts are there in terms of people with mental illness, people's health and well-being, social isolation, loneliness. These are all key factors that people face every single day, and it's now vital that myself as the community chair with other key partners internally and externally delivering that, the work and the recommendations of the contributors, and most importantly some of the users of the services highlighted within the report.
The Commission obviously had an interest in health inequalities, and the natural focus there would be to look at poverty. But because within Glasgow we have the Poverty Leadership Panel, which has a lot of work going on to try and address poverty, we invited the Commission to look at another key theme that hasn't been looked at in quite that way in the city before. So we actually suggested looking at mental health to the Commission, and they were very much up for that. We often think about mental health in relation to specific conditions, and in that context we are dealing with particular issues that people face, but it's something that is there for all of us, and good mental health is good for all of us.
Mental health has always carried a stigma. I feel we need to change public opinion about mental health issues. If someone had a broken leg, they immediately gain sympathy for that because it's a visual disability that we can all see. Mental health issues are unseen. Many people don't understand the ramifications of mental health and how that can affect your physical health as well. So it can be like a double whammy. We know that in Glasgow we have health issues, and we know that we've been working hard to overcome them by highlighting mental ill health in Glasgow and social isolation. I feel that we can draw more attention to an area that hasn't always been at the top of the list.
The Go Well study in deprived communities in Glasgow found that loneliness is most common among people experiencing long-term mental health problems, people who live alone, and middle-aged men with low educational qualifications. The annual cost to public services of social isolation and disconnected communities could be costing the UK economy £32 billion every year. Being of working age and long-term sick or disabled, infrequent contact with friends and neighbours, feeling unsafe and perception of antisocial behaviour in the neighbourhood, and lack of sources of practical and emotional support are just some of the factors that can contribute to loneliness. 40% of those surveyed reported loneliness in the past fortnight.
Being able to cope with the stresses in your life, having opportunities to develop to your full potential, and maybe most importantly, being able to connect to other people. Those are all things that potentially could affect your mental health. So it's easy to imagine how poverty, or growing up as an ethnic minority, or facing discrimination because of sexuality or other things, those have all got the potential to harm your mental health.
It's also important that we look at the inequalities in the city. Mental ill health is a major contributing factor to physical health declining as well.
Inequalities affect Glasgow more than anywhere else in Scotland. We know that for health inequalities generally, how long we live and how well we live, and that poverty is the single biggest predictor of that in Glasgow. It's not the only aspect, but it certainly plays a major part in the experiences that we have as a city.
The way poverty plays out in mental health is the effect is much, much stronger. So particularly if you've experienced adverse childhood experiences, that does make your physical health a little bit worse, but it makes your mental health much worse.
Adults living in the most deprived areas of Scotland are twice as likely to have mental health problems than those in the least deprived. And there were 2 times more GP consultations for anxiety in areas of deprivation. Typically, people with severe mental illness can expect to live 10 to 20 years less than the general population. It is estimated that up to 75,000 people in Glasgow experience common mental health problems, such as depression and anxiety.
With the changes in the benefits system, we're finding more and more people becoming more vulnerable because of their mental health issues. We've also discovered that transport plays a major role in this. We have constituents that really need to access health services and mental health services. More and more these facilities are being clustered in areas that are very difficult for our constituents to access because they don't have the cash available and because it's very difficult for them to travel the long distances to access the healthcare that they require. By looking at these issues, we're hoping to highlight and make recommendations where we can try and overcome some of these barriers. We undertook to visit areas and projects that were addressing the issues that we felt were coming through in the Commission and that were important for us to visit so that we could find out exactly A, how they're funded, B, how well they're working, and enable us to find out what we're doing well in the city and build on that. One of them was the deep end GP practices. That's a really important issue because the GPs are the gatekeepers of our NHS.
So the system is under pressure. It's not well balanced. The relationship between community-based general care and specialist care, I think, is out of kilter. If healthcare is not delivered equitably, i.e. in proportion to need, then some groups will get the benefits of healthcare and others won't. So healthcare itself becomes a driver of widening inequality. That's an issue in Glasgow. The challenge now is to convert these small projects into the mainstream in deprived areas, and they include things like providing more time for consultations with patients, a better focus on continuity so that knowledge and confidence is built up, better relationships between practices, better sharing of experience. And the bottom line is that healthcare does make a difference. If it's not done equitably, it'll widen inequality.
At my lowest, I cried out for help, but I'd hidden it so well, the doctors didn't even realise the crisis that I was actually in.
A willingness to look at people's individual needs and also the group needs and whatever. So there is that idea of a safe space where people can be themselves. So groups like this are vital, really.
I forgot how to laugh because my life was so serious just all the time. And of course that affects your health. If I don't get it together properly, my wife would have to go into care, which would cost a fortune. But now, through coming to the shed, I'm different. I feel different.
I was at the Glasgow Disability Alliance last week, and the feedback from people there was really enlightening and really powerful, actually, in terms of just how hard it can be to be able to connect with others, to come together, and how important community organisations and structures are. It really brought it home for me. And I think it raised for me issues about how do we as a city support thriving communities so that people are able to come together more easily and support each other. How can we do that better as a city? It really came through for me.